But I think the council must have had an idea of what it would do with that additional space. It's not plantable. You're not making a garden. You're making more public space, but where's the plan for that?
There are hypotheses about white great whites and breeding. It's only been witnessed once in New Zealand.
So we have 3 satellite offices, one in Eastern Charlotte, one in Campobello, and one in Grand Manan, and that's allowed us to grow those services into those areas. And it's not slowing down, it's only growing.
Welcome to This Week Uncut, where we take a look at the top stories of the week from CHCO-TV and The Courier. I'm Vicky Hogarth.
And I'm Natalie Sturgeon. We begin this week in St. Andrews, where the wharf has been top of mind.
Yes, this is a topic that has been in the headlines quite a lot in 2025 as we look to going ahead with the wharf and Market Square refurbishment this fall. Nevertheless, we are at a critical point in where we go next.
Yeah, this is kind of the do or die moment for a decision on what this looks like. So essentially, in May, roughly, there was a proposal to send a study to Gemtech to look at impacts to the shoreline. That was $25,000. They've done that study. They brought it back. The major takeaway was that the construction would have minimal or no impact to the shoreline. But there were some things in there that didn't quite jive for folks who were at the meeting as well.
Okay, so what was it exactly that was presented by Gemtech, and what was it that people in the audience took issue with?
So Garth Holder came to the council meeting. There was one other author. Essentially, we believe that's the actual person who came and did the bulk of the information gathering and sampling, who was not there. But it said that, there would be some longshore sediment transport along the corners of the infill. But they talked about mostly sand, so they didn't really discuss other debris that might be part of that kind of what would be coming in onto the shore. They talked about the water exchange rate. They said there was a slight delay in the water exchange rate, which is essentially how quickly water moves from one area to another. But when factoring in the infill, they said it was still efficient. They said that Market Wharf and Market Square are protected by Navy Island from wave action. Essentially, this whole project will lift the wharf around the wharf and Market Square up 5.5 meters. So he also said that would protect it from inshore flooding as well until about the end of the century, when you could see water coming over the top of that almost 20 feet. Okay,
I think anyone who lives in the St. Andrews area, this is an inescapable topic right now as we look to whether it goes ahead or not this fall. And it really is, as we've said already in this program, a critical juncture for this initiative. So it's figuring out what to do next. We're expecting a decision to be made if tender goes out as of the 29th. Mm-hmm.
So yeah, they're going to meet again on Tuesday. But what they faced at Monday's night meeting was a lot of pushback. People were asking questions about the study. People with expertise in the field of engineering. People who have spent their whole lives either on the water or on the water in St. Andrews, and who have sentimental attachment to this wharf. And we heard it from even a new resident who hasn't lived here for very long about, this is the identity of St. Andrews, this wharf, right? It's kind of the centerpiece, right? Market Square is the center of town. So there's a lot of feelings, there's a lot of emotions. Obviously, council is determined to get something done. Doing nothing is not an option. The first third of the wharf is under a weight restriction. They got the funding originally in 2019, so it's been a long time. Time is running out. It expires in March 2026.
Now, could there be, and I know one thing I like to stress for people at home too, is that while this could be something you consider a polarizing issue even in town, I know I have close friends that are really on opposite sides of this issue. It's great when we can be on opposite sides and still get along. I think that it's obviously taking a toll on the community right now, what happens next, but it's good to remember too that I think pretty much almost everyone coming to this debate right now is coming to it with that love of the wharf as this critical piece of our identity, and also believing that what they think is the right move is the right move. So I think that a lot of people's intentions are really pure and good, but maybe we just have different ideas of how we get to where we want to go. Some people believe we have to do this right now or we will lose the wharf, whereas the other side is saying, we need to step back and make sure this is the right way because we can't undo it if we do it. So these are the two main positions that I'm seeing in town right now, hearing a lot from residents on both sides of the wharf debate. But really, people seem to all be coming from it from a place of really caring about the wharf's future and what happens next.
I think the one thing that's become clear to me over covering this over the last 11 months since I got here is that everyone is in agreement that something needs to be done to protect the wharf. What way they choose to do that is the question that everybody has. And this infill will change what it looks like. It will change it. And so as someone pointed out in the meeting, once you do these things, you can't undo them. So picking this option, whether it takes longer or whatever the case is, or if it was quicker or more affordable, everyone agrees that something needs to be done. It's the option that they've chosen that is in question.
Now, given that 2023 was when these options were presented to the public, this has been a topic that the town's been dealing with since 2019, 2023, fall of. Many of us in the community were asked to come to multiple meetings about different wharf designs to vote on which one we felt was the better option. And we were made aware of the funding with the federal government, that it had to do with climate change, so funding would only go towards a project that addressed climate change. So all that was made aware to the community 2 years ago. Nevertheless, it feels like the prices could change. Was there any talk of that? Because when we were talking about pricing in 2023, when you look at the global trade war we're in right now, things of this nature, we saw pricing go up in the pandemic as well. Could this be that even though if we choose to go ahead next week, that it might be at a price tag that wasn't originally in the cards?
Well, and I'm glad you mentioned the consultation process, because Councillor Steve Neal, who is an expert in biology, was talking about the fact that he felt this wasn't the option the public chose, but the one they settled for. So you're right. Time has elapsed. Labor is more expensive. Material is more expensive. They will go. The next step is to send it to tender, which could take multiple weeks. Or they could expedite the process given the timeline that they want to start in October. But it is likely to be more expensive than it was in 2019. They did get a little bit more money in between that time, but it's certainly not enough. $8 million in total, $2 million from the town, $6 million from the federal government. So it's a question of, if it comes in over tender, is it even possible to do this option? Then they have to go back to the drawing board. It is worth mentioning, it is possible they could go back to the federal government and ask for this money again. Climate change is not...
reapply for this grant. Okay.
Climate change isn't going anywhere, it's only going to get worse. So this money in this fund may be available to them. So if they get to a point where the money is gone, it is possible they could reapply. Okay,
but it could be that, I know that the point of going ahead in October was that it wouldn't affect that much of those businesses that depend on the wharf, be it whale watching. We've got people like Greg Beckerton at the wharf, all done. I think everyone knows it's my favorite boat if you follow me on Facebook. There are people that really do depend on the wharf for their livelihood, and going ahead this October would have minimal impact. They could be done in time for that tourism season next summer. Nevertheless, I think, again, when you say things like tender, it could be that the price tag is more than we were originally imagining just a couple years ago. Things could change. Plus, if there is this pushback, is October really feasible?
Right, exactly. And it'll all come down to Tuesday's meeting, the tendering process, and then ultimately what that tendering process says. Is it 10 million? Is it 12 million? What does that look like? And what do they do if it comes in over tender?
And again, in terms of expiration of this federal funding, it has to be used by...
March 2026 is the expiration date, and I did hear in the meeting, Chief Administrative Officer Chris Spear kind of suggested that they would not extend the deadline again. So time is running out.
Okay, so it really is a question of urgency and whether this is the right move right now.
Exactly. We're going to take a listen to some of the things residents said during the council meeting.
Thanks to council for all your good help, I'm sure.
Thank you.
We'll get to know each other. But to be short, to be clear and honest, I don't know the wharf background very well. I only saw, I forget your name, but your study, thank you. It's a very technical study, and it tells me nothing about why It was designed this way. It's a study that demonstrates why it doesn't have impact and in what terms, what technique. So that's fine. We can categorize this as such. The wharf itself has, of course, other repercussions. You have to look at it not just from the. I wonder, I've been told that there is money coming in that should be used, otherwise you lose the money. Should we use it for that in particular? Do we need to use all that money? If the idea is to just prevent further erosion, what caused this design to reach out like this? I don't see the necessity of going out like that. Maybe there's a logic about the construction, a saving somewhere. I'd like that to be explained to me, but in part. But the real question I'm here asking is, once you do infrastructure in a city like this, you really, it says St. Andrews by the sea, not St. Andrews by the landfill, right? A lot of it is already like this. This is one area where you have a way to plunge a boat, the old ramp there. There's a little bit of a closer contact to the sea. If you project the land and make a steep ridge that's not walkable, not accessible, except for the one place I saw in the plan which has a stair, then you're actually making the sea further away from Water Street, from the mental environment, what the civic idea of St. Andrews would be. And so I'm thinking, maybe there's good reasons for all this. There's this odd shape. I can't explain it for myself, but maybe there's a reason. I'm ready to listen on that. But I think the council must have had an idea of what it would do with that additional space. It's not plantable. You're not making a garden. You're making more public space, but where's the plan for that? Do you have one? I'm simply humbly asking. But I would really think this is important because in my work, international urban planning policy in developing countries, I find that the impacts of infrastructure on cities as they grow, the demand of that kind of growth, expressways, the enlargement of ports, it's part of my subject study. I do that. Those impacts are enormous. They really have a repercussion on the quality of life in the city. And so, therefore, here I think we're affecting the identity of the town. No doubt that it will change something. Maybe you'll say, well, we can put a bigger tent for a bigger farm market or something. But I'm not sold on it.
Thank you for that excellent presentation, Mr. Holder. I was really quite impressed. I've got a couple of questions about DHI Mike 21, Danish Hydraulic Institute, which has been used for quite some time now, including organizations like the Army Corps of Engineers uses it. But this is a 2D code, is it not?
Excuse me, your question was a 2D code, two-dimensional?
Yes.
Yep. No, it can be, there is depth involved in it as well, can be integrated into it. I would have to go back and check the specifications exactly for that, and my colleague Zenyan would be able to express that right away. However, it is the commonly used modeling for the Atlantic Canada. Both CBCL and Gymtech and RPC use it, and have used it, or not RPC, but National Research Council used the DHI model to model the different gullies and structures around the provinces and the Atlantic Canada and across the country. Okay.
Thank you, Mr. Holder.
Okay, there was another question. When you were working on your hydrodynamic model, which was the wave height one, you said you calibrated it. And was it someone came down and measured some wave action? That was your calibration?
The calibration, or my colleague Zenyan had come in and monitored the wave logger in order to confirm the frequency of the waves that are coming in on that structure. The calculation of the wave height is part of the model, and it is calculated from the onshore winds, local winds, and he felt that there was no. He felt because of the configuration of the harbor that there would be no offshore wave coming into the harbor because of the sandbars and the configuration of the Navy Island. Okay.
Thank you.
Thank you, Mr.
Got
Holder.
another one before you go. You talked about sediment transport, and did someone come down and take some sediment samples?
Yep. Excuse me. There are 4 samples taken inside the on the sea bottom floor. In those locations, I'm pointing to 1, 2, 3, 4 sediment locations on either side of the wharf, 2 on either side. He noticed that at low tide, only small patches of sand near the shoreline area. Other areas are gravel. I'm losing my voice. Rock bed and seaweed. Sand patches are only a small part of the shoreline area.
Okay.
And those were sent to the Gymtech lab for the grain size analysis, and it is a fine sand that he sent to the Gymtech lab, and it comes out as a fine sand.
So the particles that were seeded into that model were based on that distribution, is that correct?
So the particles that were put into this distribution were these size of sands.
Okay.
However, there's only patches of sands. However, he put the thickness of the sand into the model in order to create sand for it to disperse.
Okay.
But where there's no sand, then the dispersal sand shouldn't exist because there's no sand to disperse. So he modeled sand, but there's no sand there, just patches.
Does DHI Mike 21, does it model floating debris?
I'm not sure. I have not seen that being modeled before in my experience.
Okay.
Yep.
I question the sand when you look over at the wharf. It's mud. There's a lot of mud there. Admittedly, there are the solid rock, but there is a lot of silting up. The drying out grid there, if you look down at that, it's almost flush with particulate that's washed in there. That has formed over the last 8-10 years. It has really built up. And so what I can see happening is you're getting more sand coming around that point, covering up the mud that is there, that is a whole ecological system in its own. I live in the end of Augusta Street, and 15 years ago, you needed rubber boots when you went down to the water line. Thick mud. Now that is all sand because of the washout from the storm sewers that have been put in at the end of Augusta Street. And so again, it's smothered out all the microbes and all the small creatures that live in the mud. And I just see the same thing happening again in that area, just on the south side of the wharf.
That was some of the comments from residents during the St. Andrews Council meeting on Monday night. We're going to take a quick break, but when we come back, we'll discuss a vital healthcare update in St. Stephen and what they're doing to improve primary care.
And I know if you're sick and you need a doctor, you'd like to have one now.
Welcome back to This Week Uncut. I'm Natalie Sturgeon.
And I'm Vicki Hogarth. We are heading over to St. Stephen where there is exciting news on the healthcare front.
Yeah, so during the Committee of the Whole meeting, Council provided a critical update in their journey towards a collaborative care clinic. Some people will recall that it's one of 10 places that will receive a collaborative care clinic in the first 18 months of the Liberal government's mandate, of which we are already 7 months into. So we're going to be keeping track of that timeline, but they have made progress. They hired 1 social worker, 1 respiratory therapist, And the town has also successfully recruited a doctor.
Wonderful news, and I know that we've covered, there's been two deaths of family care providers in St. Stephen this year, so it's definitely taken a toll on people in the community who are able to access family care. So this is exciting news. We're already seeing that online in terms of our viewers responding to this announcement. But what are the challenges as this goes ahead?
Right. Well, everyone's waiting to be matched, right? That's the problem. There's thousands of people in southwestern New Brunswick who are waiting to be matched either with a family physician or with a collaborative care clinic. And not every community is going to get a collaborative care clinic this year. But it's interesting. So if you take a listen to the deputy mayor's comments, she explains what the work they've been doing in order to get this clinic off the ground.
At the last meeting, I told people that we were getting a new doctor, right? And I said, make sure that you're on the New Brunswick Health Link or you go through 811. We got one doctor and we have like 6,000 people on the link, right? I thought, okay, that's a little, that's a little difficult. And thinking if we were going to take on everybody, we'd have to get quite a number of doctors. But since then, we've gotten some information on what it is that the province wants to do. And that is included in your package, okay? So they gave a really nice update. So right now, if you need to see a doctor and you don't have one, you could call the hospital and ask them for the wellness clinic or a doctor. And I know different people have called me and they say they're having a hard time getting in. But if it's urgent and you need to have it looked after, then you can go to outpatient, right? Anyway, and then a little while after, we met with Minister Dornan, and he said, he was talking to us about the family health team that they're building, and this is what they want to do for the whole province. And he said, rather than being attached to a doctor, you would be attached to a clinic, right, to the health team. So he said, anyway, we're hoping by 2029 that we'll have everybody in New Brunswick attached. So you could see the look on people's faces. 2029 is not going to be, but I've given it a lot of thought, and then right now, like in our region, they've welcomed a couple of professionals. For example, they have a social worker and respiratory therapist, and these people, you do not need a referral to go see them, so you would just call the clinic if you need to see those. We've also, our new doctor is here, and things are working very well, and we're going to work on getting more doctors. So what they're going to do is build the teams, and then hopefully we can have the clinic. So really by 2029 we'll have our clinic, we'll have the whole team, and we'll be good to go. And when I was looking at the information too, like they have an example of who they could have on the clinic. And I remember one time going to see the doctor with my husband, he was diabetic. Anyway, she had to set up an appointment with a diabetic person, right? So if you go to a doctor, they're going to have to look for somebody, but this way, then you have the whole team. And also, they're going to be working with people that are already here. Like we have doctors that have their own practices, and they're going to get them involved with the clinic. They might work in their own building, but they would be involved with the clinic. And I know it's kind of a hard thing to put in your mind. Like, I mean, you know, like when I was young and I got a doctor and I kept the doctor like basically up to now, right? But the doctors all seemed to be retiring at the same time, so then they were gone. And also, like if you look at new doctors coming in, they come out of medical school, they have, like somebody said, something like $400,000 worth of debts. And are they going to want to come into a community and set up practice, right? Plus have 3,000 patients and last for the whole time. So I think this is more attractive to people. And there were a couple, the session that Councillor Rodas and I went to, there was an older physician, and he said, you know, most of my patients are about my age and they need a lot of care, and I'd like to start phasing out. So he said, I'd be quite willing to work in a clinic for a day a week or 2 days a week. So it's a lot more attractive for younger people and older people, and hopefully by 2029 everyone will be attached. Now, and I'm saying this right now, if anybody wants to call me and talk about it, we can. When I'm on here, it's difficult to explain, but when I have a conversation, people can ask questions, and it's hard to explain sometimes to make people understand what's going on. And I know if you're sick and you need a doctor, you'd like to have one now.
That was Deputy Mayor Ghislaine Wheaton of St. Stephen.
Yeah, so that was part of the update, and you could hear that she was sympathetic with people who are frustrated by the fact that if they're sick and they don't have a doctor, they want one now. We understand that. It's going to take time. We encourage people to be patient, especially if you're calling the wellness clinic in St. Stephen. If you can't get in, be patient. It's important that you're patient through that process. But also, they've been working to recruit doctors. A couple of months ago, the council introduced a very robust incentive program. Basically, it offers money for time commitments in the community up to $100,000 a year, which will be factored into their budget. You'll see that as part of the budget process. And they were able to recruit one Dr. Saber, who is now actively working and taking patients. His wife Emil is also also a doctor who is working towards her license with the college. So that's 2 doctors that have actually been recruited to the area.
Oh, that's so exciting. I look forward to meeting them, to welcoming them to the community. It's a wonderful place to be. I know that in COVID-19 we saw an influx of people moving here. We thought that might slow down, but it appears to be that small town life on the East Coast is still appealing and attracting everyone from new retirees to new doctors.
Right. And part of the incentive package, Councillor Emily Rodas said she wanted it to be part of integrating these folks into the community, showing them what St. Stephen has to offer. Take a listen to what Councillor Emily Rodas has been doing with Dr. Saber and his family.
Maybe we could do even, Deputy Mayor Wheaton and I could do like a little coffee house here one day where people can come in and just ask us questions about the primary health team model. But it sounded like, from what Minister Dornan said, just because if the shovel may go in the ground far before 2029, but their ultimate goal for the whole province is that by 2029, nobody will be unattached, period. So that means that you will have consistent access to care no matter what. That means if your doctor's on vacation, or your primary physician that you see, there's somebody there in their place. If you need a social worker, an RT, a physio, you have consistent access. If you need to just be able to call, telehealth, and get answers to questions, you'll be able to have access. So on this photo, I'll actually probably share this on social media and maybe give it to the town too to share, but it says healthy homes, healthy neighborhoods, and healthy communities. So it's kind of branching out to make sure that you access the care at the right place, and that way physicians can actually focus on just physician roles. And so that means when you have an emergency, you go to the ER. But it's kind of the same as registering for this clinic. Like if it's an emergency, like if you feel that you have been having a consistent cough for 8 months, please go to the ER and just have them order a CT scan and maybe go in our new machine. Like I don't want people waiting to, if they have something going on right now that they've noticed for months, don't wait to go to the primary health clinic, right? We want you to go to the ER for those things. But If you have to call every day, all day, if you can be patient and you can get through it, we have had many successes. It's just they're trying to figure things out. And then over time, they will continue to add physicians. When you go to the third floor, you may not see Dr. Saber. It could be another physician. So people are being very confused by that already. They've gone and they've seen maybe Dr. K or Dr. Atchison or another local physician. But that's because everyone is jumping on board to this primary model. So they're rotating through all the time, but there's an electronic health record and all of the information is able to be accessed. As far as Dr. Saber, his wife Amel is also a physician, which is wonderful news. She is working with the college to try to obtain her license as well. Deputy Mayor Wheaton and I have spent, I feel like every other day we're with the family. We've been going on walks. We connected them to sports, soccer, basketball. We've talked with the high school principal about doing a tour. We obviously secured the rental through the RSC for July and August, and now we've secured them a longer term rental for the whole school year, so they have time to just settle in. So if they want to purchase, they have time to do that, and they've been connected with Jeff as well. So that could potentially be 2 physicians. So if you meet them in community, I've noticed people stopping by their house and saying, welcome, hi, how are you? Just remember they're also citizens, so treat them as such. Don't hop into the physician problems right away, but just give them a warm welcome to the community. And they have kids in elementary, middle, and high school, so I'm sure you'll be seeing more of them.
That was Councillor Emily Rodas of St. Stephen. We're going to take a quick break, but when we come back, we will explore how the Nursing Homes Without Walls program is enhancing lives of seniors in our community.
Recently, we've helped 120 people apply for a direct-to-tenant benefit, and a lot of those people we already had as clients, so we knew they would qualify for this benefit.
Welcome back to This Week Uncut. I'm Vicki Hogarth.
And I'm Natalie Sturgeon. The Courier's Aidan Rayner heard during a press conference with Premier Susan Holt after there was many questions about the prioritization of long-term care patients from the hospital that no longer need acute care be moved into long-term care facilities, that the Nursing Home Without Walls program was seeing an uptick. And so he got curious and pitched me an idea, and he actually went to speak with some folks who are familiar with that program.
Yes, Natalie, I was downstairs talking to the people involved, and that was Carolyn Davies, who gave me a little bit more of the overview of the program from the board's perspective, and Emma Keach, who is on the ground. I was only able to talk to her on the Wednesday because on Tuesday she was in St. Stephen. And I learned some really interesting things about this program that aren't really common in other healthcare systems, and this one really stems from the need to be adaptable. Not every healthcare program can be adaptable. Like with us, the struggle we're dealing with right now where, seniors that should be in homes that don't really need to be in the homes in the bigger homes that they are now, but there aren't enough beds to fit them at any nursing homes clearly in the whole province.
Right,
definitely getting to
there's an issue of labor there, right? There's not enough people to man the beds. There are beds available. There's just no labor to oversee them.
And coupled with the baby boomers are now getting into their 80s. It's my dad is a 1946 baby. He is turning 79 this fall, so we can see this age group starting to be a bigger priority for healthcare, but also in terms of the mass numbers, a concern.
Sheer numbers, like if you look at the population charts of the province, they are ridiculously clustered near the ages where they would be needing to receive care. And I found the most interesting thing of the adaptability of this program in Charlotte County was just how they serve the islands and rural communities. There's really no part of Charlotte County that is a kind of urban center. And so they really need to be out, and so that's why they have 3 satellite kind of operations. And if seniors need help, they are pretty able to help with most things if you give them a shout. And it is really a remarkable program and how they deliver adaptable care to those who need it. Emma did tell me, though, that the difficulty and the part that they are hearing is that they need help with transportation.
Okay.
Because there is no urban center that like seniors are living in Charlotte County, they can't get around. She told me an example of Maces Bay. She was there the other day, and a lot of the seniors that she heard from needed transportation because they were getting to a point where driving wasn't an option. And there's not
The service is
public
like dial-a-ride,
transportation.
but definitely comes with definitely heavy coordination and making sure there is availability.
Exactly. So that's one of the things that they will continue to work on going forward. And an example of their adaptability is that they are able to transition into doing that. Or another thing, if someone needs a walker or a cane or something like that, they will be able to provide them on loan and for however long as the person needs them, which is quite remarkable.
And just to clarify, the Nursing Home Without Walls program is what the name suggests. You stay at home. It's designed to keep seniors in their home for as long as possible so that they don't need to go to a long-term care facility.
Exactly. It's like what the Premier said last week, keeping people away from emergency units and hospitals as long as possible. And this program really tackles that in the most creative way that I've seen.
And beyond things like overcapacity, there's issues like quality of life. When you're able to stay in your own home, that can drastically improve your quality of life. Did they touch on that at all?
Certainly. Like this program is keeping people in the homes that they know, in environments that they're comfortable in, and this program really does a good job at making sure that we can keep seniors aging in place in a way that makes it possible for them to kind of live the way they have before.
Here is Aidan Rayner's interview with Caroline Davies of the Passamaquoddy Lodge Board and Emma Keach, director of the Charlotte County Seniors Resource Center.
So it's a bit of a misnomer because it's called Nursing Home Without Walls, but however, there is no nursing home involved in terms of we're trying to keep people out of the hospitals and out of the nursing homes. It's a program that looks to put in place or better connect people to the services available so that they can stay in their homes and live healthy, active lives safely at home and not go to the emergency, not have to be in a nursing home when they really don't need to be there, but there's no place else for them and there's no support for them.
And how long has this program been going on, and why did it have to start? I know there was the Premier the other day healthcare is the number one priority. And how is this involved in solving the other kind of issues in healthcare in the province?
So the program was started, the federal government gave the province $75 million to look into projects that would help serve seniors. And the initiatives that came out of that were shared either across the province or across the country. It was basically a live research project, and one of the first projects that came out of that was a Nursing Home Without Walls project, mainly in the eastern part of the province, to see how we could keep people in their homes and what they needed to stay in their homes. The project unfortunately unfolded during COVID, so there were impacts, but COVID actually highlighted the fact that we need to help support people staying in their homes, and they don't always have the connections, especially in rural New Brunswick. So the project was a success, and the government has adopted its premise and is rolling it out across the province. We applied relatively early on in 2022 for funding to implement this program. We had done some research into what the community felt they needed to stay active and healthy as seniors. And that initiative under the Healthy Seniors Pilot Project identified 6 priorities for seniors. 2 of them the town has undertaken, an activity center and a workout space, which are co-located with the youth center and is being, there's a big uptake of use in that. And 3 were taken on by the Passamaquoddy Lodge Nursing Home. The adult day program was basically the number 1 priority, a pool, therapy pool, and the resource center. The only one that we were able to find space for is the resource center at this time. We are proposing to build a new nursing home that would include space, purpose-built space for the therapy pool and for the adult day program, which must meet provincial regulations. And there is no space in this community that could be adapted to that at this time. So until we've got that new facility, we can't implement those two programs. There is a sixth pillar, a community kitchen, which we're still working with the community to see who can maybe undertake it. If not, it'll be part of our community hub in the new Passamaquoddy Lodge complex.
And how successful has the program been so far?
The program, I think, is in terms of Charlotte County. Our implementation was Charlotte County wide, so it takes all the islands. It goes Eastern Charlotte, St. Stephen, and Emma can elaborate a lot more on that because she deals with it daily. But it's, I think we thought we'd have a nice, quiet launch. We did, sort of, but the uptake has been amazing and the feedback has been amazing. And it underscores the need for the interconnectedness of all our programs that sometimes I think because maybe they didn't know what other elements or other businesses didn't necessarily get together to help people stay in their homes. And one of the things that I'm observing, and as I say, Emma can speak more clearly on this, is that people are realizing that there are services out there and they're being directed to them and they're getting a lot of help as a result.
Well, I consider myself very fortunate because I was part of the HSP project, the Healthy Seniors Pilot Project, and so I was able to be privy to the conversations of what the community needed. There was 100 ideas that came out of that, and it was narrowed down to 6, as Carolyn has spoken about before. So the Resource Centre was one of those, and we knew that was going to be a community-driven program, and it has been. We've listened to the community, and we tailor our services to those community needs.
And what were those things that the community kind of brought to you out of those 100? What were those 6?
So the one that we're working on today is the Resource Centre. So that would be accessing services that are already available, navigating the digital world. As everybody knows now, a lot of programs and applications are online, which is a struggle for many, many people who don't have access or do not know how to do that. So we've bridged that gap and are assisting people apply for those programs.
How will there be implementation of, does this program encapsulate all of those 6, and is there plans to continue to kind of incorporate those?
Absolutely. We're hopeful with the new build that we'll be able to facilitate the adult day program in the new build of the Passamaquoddy Lodge and the therapy pool. So, but right now we're obviously very fortunate to have the Resource Centre open and serving 416 clients currently.
And where are those 416 clients?
So we serve the whole of Charlotte County, including the islands, Whitehead, Deer Island, Grand Manan. When we first started, there was just 2 of us, and now we have 6 staff. So we have 3 satellite offices, one in Eastern Charlotte, one in Campobello, and one in Grand Manan. And that's allowed us to grow those services into those areas. And it's not slowing down, it's only growing.
And must be busy with 416. What does your day-to-day look like?
Serving those 416, they all have different needs at different times. So when we started, we might have helped them in 2024 with a low-income senior benefit. But the beautiful thing is they've become a client, and now we have helped them again apply for 2025. So, and as we have them as clients, we're able to see what other things they may be eligible for as they come up. So recently we've helped 120 people apply for a direct-to-tenant benefit. And a lot of those people we already had as clients, so we knew they would qualify for this benefit. So we were able to reach out to them and help them.
And could you describe the Nursing Home Without Walls program, and what are the steps that people kind of need to qualify for if they want to become involved?
So there's no qualifying. We try to serve people who are 55 plus. And we've got referrals from extramural, doctor's offices, people can self-refer. We have an office here that people can come to. So we're getting different referrals and through lots of different trusted entry points, but there's no qualification, just to be 55 plus.
Okay, right. And what sort of things does the Nursing Home Without Walls program specifically help people that are 55 plus with?
So, as I said before, we are community driven. So we've had people come to us looking to apply for the dental program, but they don't have necessarily the know-how. So we've helped them with that. We let the client tell us what we need, what they need, but we can also make suggestions of other things they would be eligible for.
That was Caroline Davies of the Passamaquoddy Lodge Foundation and Emma Keach of the Charlotte County Seniors Resource Center. We're going to take a quick break, but when we come back, we're going to take a look at the great white shark and what's on the list for the crew at CHCO-TV and The Courier.
No, it said it was doing the shark survey, and as I say, I know they are around. I've never seen one. I've seen a basking shark, which are huge.
Welcome back to This Week Uncut. I'm Natalie Sturgeon.
And I'm Vicki Hogarth. We had an exciting week when it comes to getting out on the water here in Charlotte County. Dr. Steve Crawford, he's a fish ecologist from the University of Guelph. I'm sure a lot of people are aware at home. We put a call out in the Courier. I know that our friends over at Quaddy Tides in Eastport did as well. He's doing a study involving the community right now, looking for white sharks in the Passamaquoddy Bay exhibiting unusual behavior. Now, the idea behind this study is that if we can get enough people from the community involved in sharing stories of things they've heard, but also going out on the water this week, looking for unusual behavior, if this is documented, Dr. Crawford believes this could potentially lead to us discovering that the Passamaquoddy Bay may in fact be a breeding ground for the white shark. So really exciting research. It's something he's been working on since around 2019, I believe, that he's been coming to communities from Florida all the way up to Quebec in the Northwest Atlantic, interviewing people who've had sightings, people that work on the water, everyone from scientists to fishers to community members to Indigenous leaders who have a long history, a relationship with the white shark that is equally as important. And taking all this information from the communities as well and what they've seen to figure out if this could potentially lead to some groundbreaking research.
Well, I'm not really interested in looking for sharks, but it does sound very fascinating, and I wonder what would happen if they did discover that this was a breeding ground for white sharks.
You know, I think a lot can be said for, especially over the last 50 years, when you think of movies like Jaws coming out 50 years ago this summer and what it's done for that, pop culture idea of what a white shark is. The reality is, for those of us who live by the water, there tends to be a great appreciation for their role in the ecosystem, for just what an epic creature they truly are. So what I'm hearing from the community, from the people that live here, is just this extreme excitement to also to know this could be a reality, whether it is or not. I know we have a lot of sightings around here, which make it very exciting. Oftentimes it makes the news here at CHCO2, and if there's ever video footage. I know we had an exciting one in Graham and Ann a couple years back that we used in our story this week that came right up to about. So I think the population of Charlotte County is quite excited. Here is Lucas Kohler's interview with Alistair Fox before leaving on the white shark study here at the St. Andrews Wharf.
Everybody's fascinated by sharks. Just coming down here, someone asked me, are there any sharks in the bay? And I said, oh yeah. And it seems to be a mystique about sharks because they are so elusive. And then you have films like Jaws that kind of turns them into this horrendous killing machine. So, no, I think the great part about it is the community, the way it is banded together, and all kinds of volunteers and boats, and we're covering a large area from now until Saturday.
Okay, and I want to loop it back. What exactly are we doing today?
We're going to be cruising around Hardwood Island up towards Boquebec, that area, because there are lots of inlets, sandy beaches, ledges, and there have been seals seen. There have been a lot of seals in that area. So it's just a matter of slowly motoring around and keeping your eyes peeled. And then when we're coming close to shore, to put a drone up so you can check out that whatever inlet we're by and see if we can see anything from the air. That's the most likely way you're going to be able to see a shark.
That was Alistair Fox speaking with CHCO-TV's Lucas Kohler about the research they were doing in the Passamaquoddy Bay. Now we're going to look ahead to what is planned for next week, and as we said earlier in the show, we're headed back down to the St. Andrews Council chamber to find out what happens next for the wharf.
That will be, I think that a lot of these meetings with wharf had really standing room only at times. I expect it will be the same.
Yeah, I also just want to encourage folks to be civil to each other. There's a way to do this without getting personal or without getting engaged in a back and forth. It really is a time for us to understand that disagreeing is okay, and we will find a path forward no matter what side we are on.
I think that is definitely a point to remember, is that while we think of the wharf as such a critical piece of our identity, the true identity of the town belongs to the people themselves and the neighborly relationships we have with one another. That's really what attracts people to coming to a small town. So I'd hate to see the thing that we think visually is our identifying piece impact how we truly are as neighbors. And I think that's the hardest thing about it, is when these decisions are difficult and you do see those two sides really form over an issue. It's how do we go ahead as neighbors when we realize that maybe it could be half the town disappointed in the path forward. This is really issues that we deal with on a community level when we are covering issues like this.
Not everybody is going to be happy. No matter what happens, it will disappoint somebody. So at the end of the day, it's just important to remember that we're all neighbors, we all love the wharf, and we all want it to be part of this community's future.
Yeah, I've said this many times. I have friends on both sides, and it really is at times hard to even cover it. I think that makes our job easy in such a way, though, because what you want to do is just give people information to think for themselves.
Exactly. But we're also going to go back to St. Stephen. There's a regular council meeting happening next week as well. So we'll take a look at what they're discussing there. We've got some information from the St. Andrews Council as well about the BIA, an initiative the BIA is undertaking, and the future of the negotiations to transfer the courthouse.
Okay, well, I am hoping to have, as I mentioned, Dr. Crawford in to talk about the shark study over on Campobello. Shout out to FogFest, takes place next week. Always an exciting time to go over the island and get a fix of music, art, and just that scenery. We know the star of FogFest is really the fog. That's what is a beautiful part of island life. So headlines, usually the fog. Yeah, I do love that part about Campobello FogFest. It always lives up to its name. And hopefully, if I do make it over, I'll be able to bring the August edition of The Courier over as well, because it will be out next week.
And a reminder, the ferry is available to get to Campobello. You do not have to go through the United States.
It's true. You can either go over to Deer Island to Campobello or drive through the U.S., but I understand a lot of people might just want to go the Canadian way.
Yeah, it's a bit of a journey, but what isn't in Charlotte County?
Yeah, a beautiful journey on the ocean. And you can look for sharks the whole time and be a part of a study, so why not? Thank you for joining us this week. We will be back again next week with more of This Week Uncut. I'm Vicki Hogarth.
And I'm Natalie Sturgeon.